If you've been feeling exhausted no matter how much you rest, if you've lost muscle and gained belly fat seemingly overnight, if your motivation has disappeared, or if you just don't feel like yourself anymore, your daily habits might be quietly destroying your testosterone levels without you even realizing it. And here's the concerning part. Some of these habits seem completely harmless. You might even think some of them are healthy, but they're silently sabotaging your hormones, your energy, your strength, and your overall vitality every single day. Today, I'm going to reveal the most common daily habits that are tanking testosterone in men. And more importantly, I'm going to show you exactly what to do instead to protect and even boost your levels naturally. Before we dive in, do me a favor. Hit that like button right now. Drop a comment telling me where you're watching from. And make sure you subscribe, because what I'm about to share could completely transform how you feel in the next few weeks. My name is Dr. Narita, and I've been a urologist for 12 years specializing in men's health and hormone optimization. And today we're exposing the daily testosterone destroyers hiding in plain sight. Let's get into it. All right, before we talk about the specific habits that destroy testosterone, let me address the most dangerous myths I hear from men every single day, because these misconceptions are causing massive harm. Myth number 1, low testosterone is just part of getting older. There's nothing I can do about it. This is one of the most damaging beliefs out there. Yes, testosterone naturally declines about 1% per year after age 30. But the dramatic crashes many men experience are not inevitable aging. They're the result of lifestyle factors that are completely within your control. Myth number 2, I need testosterone replacement therapy. Lifestyle changes won't make a real difference. While TRT has its place for some men, I've seen countless patients raise their testosterone by 200 to 300 points naturally, just by eliminating the habits that were destroying their levels. Lifestyle optimization should always be the first step. Myth number 3, if I'm eating healthy and exercising, my testosterone should be fine. Diet and exercise matter tremendously, but they're not the only factors. Many seemingly harmless daily habits, from how you sleep to what you drink to how you manage stress, have profound effects on testosterone that most men completely overlook. Myth number 4, I'll know if my testosterone is low because I have obvious symptoms. Many men with clinically low testosterone feel okay, just not great. They've slowly adapted to lower energy, decreased motivation, and reduced vitality without realizing how much better they could feel with healthy testosterone levels. Myth number 5, testosterone is only about muscle and performance in the bedroom. Testosterone affects virtually every system in your body. Your energy, mood, cognitive function, cardiovascular health, bone density, metabolic health, and overall quality of life. It's not vanity, it's foundational health. So, here's the reality. Your daily habits create the hormonal environment in your body. Every day, you're either supporting healthy testosterone production or actively destroying it. And most men are unknowingly doing the latter multiple times per day. Today, I'm going to show you exactly which habits are the worst offenders and what to do instead. Now, before we get into the specific habits, let me explain why you should trust what I'm about to share. In my 12 years as a urologist, I've worked with thousands of men dealing with low testosterone, fatigue, weight gain, performance issues, and overall vitality decline. And I've seen a consistent pattern. When we identify and eliminate the daily habits that destroy testosterone, men experience dramatic improvements, often without any medication or hormone therapy. I've seen 45-year-old men raise their testosterone from the low 30s to the high 500 seconds just by changing daily habits. I've seen men regain energy, lose belly fat, build muscle, improve their mood, and restore function they thought was permanently gone simply by stopping the behaviors that were tanking their hormones. This isn't theoretical. This is based on clinical outcomes I see regularly in my practice, combined with solid scientific research on what actually affects testosterone production. So, if you're ready to identify and eliminate the habits that are quietly destroying your testosterone, stay with me. All right, let's break down the most common daily habits that are absolutely devastating to testosterone levels and what you should do instead. Habit number 5, chronic sleep deprivation. Let's start with one of the most powerful and most overlooked testosterone destroyers, poor sleep. Here's what most men don't realize. Approximately 60 to 70% of your daily testosterone production happens during sleep. specifically during deep sleep stages. A study in the Journal of the American Medical Association found that men who slept only 5 hours per night for 1 week experienced a 10 to 15% drop in testosterone. That's the equivalent of aging 10 to 15 years hormonally in just 1 week. And here's the problem. Many men are chronically sleep deprived. You're staying up late, scrolling through your phone, watching TV, working late, or dealing with stress and insomnia. You might think you're functioning fine on 5 to 6 hours of sleep, but your testosterone is being destroyed. Biologically, during deep sleep, your brain signals your testes to produce testosterone. Poor sleep disrupts this entire hormonal cascade. Emotionally, low testosterone from poor sleep leads to irritability, mood problems, and lack of motivation. Practically, it means chronic fatigue, poor performance, and gradual health decline. What to do instead? Prioritize 7 to 10 hours of quality sleep every single night. This is non-negotiable for healthy testosterone. Create a consistent sleep schedule. Make your room dark and cool. Avoid screens for 1 to 2 hours before bed and address any sleep disorders like sleep apnea that might be disrupting your sleep. Sleep is the foundation. Get this right, and everything else becomes easier. Habit number 4, chronic stress and elevated cortisol. Now, let's talk about stress, and specifically chronic stress that keeps your cortisol levels elevated all day, every day. Cortisol and testosterone have an inverse relationship. When cortisol goes up, testosterone goes down. It's not a minor effect. It's dramatic and consistent. Chronic stress keeps you in constant fight or flight mode. Your body is designed to prioritize survival over reproduction. So, when cortisol is chronically elevated, your body actively suppresses testosterone production. You're telling your body, we're under threat now, is not the time to produce sex hormones. And here's what creates chronic stress for most men: work pressure, financial worries, relationship problems, poor sleep, which creates more stress, excessive exercise, constant connectivity and phone checking, never taking breaks, and trying to do everything for everyone while neglecting yourself. Biologically, elevated cortisol directly suppresses the signals that produce testosterone. Emotionally, chronic stress creates anxiety, irritability, and emotional exhaustion. Practically, it means you're constantly on edge, never fully relaxed, and your body is prioritizing stress hormones over testosterone. What to do instead? You must actively manage stress. Not just talk about it, but actually do something about it. This might mean daily stress reduction practices like meditation, deep breathing, or yoga, setting boundaries around work, and saying no to non-essential commitments, taking regular breaks throughout the day, engaging in hobbies and activities you genuinely enjoy, addressing relationship or financial stressors directly rather than avoiding them, getting professional help through therapy or counseling if needed. Your testosterone cannot be optimized in a chronically stressed body. Period. Habit number 3, excessive alcohol consumption. Let's talk about alcohol. And I know this isn't what most men want to hear, but it needs to be said. Regular excessive alcohol consumption is absolutely devastating to testosterone levels. Here's why. Alcohol increases the conversion of testosterone to estrogen through an enzyme called aromatase. It damages the Leydig cells in your testes that actually produce testosterone. It disrupts sleep quality, especially deep sleep where testosterone is made. It increases cortisol. It promotes belly fat accumulation, which further lowers testosterone. And it impairs liver function, which is necessary for proper hormone metabolism. Research shows that even moderate drinking can significantly lower testosterone. One study found that men who consumed 3 or more drinks per day had testosterone levels 6.8% lower than those who didn't drink. And if you're having several drinks multiple nights per week or binge drinking on weekends, the effect is even more pronounced. Biologically, alcohol is a direct testosterone poison that disrupts production and increases conversion to estrogen. Emotionally, it might provide temporary stress relief, but ultimately contributes to mood problems and energy crashes. Practically, regular drinking is incompatible with optimal testosterone levels. What to do instead? If you're serious about optimizing testosterone, you need to dramatically reduce or eliminate alcohol consumption. This doesn't mean you can never have a drink, but it does mean limiting consumption to special occasions only, not daily or even weekly. When you do drink, limiting to 1 to 2 drinks maximum, having several alcohol-free days every week at minimum, finding alternative ways to relax and socialize that don't involve alcohol. I know this is challenging for many men, especially if drinking is part of your social routine, but the testosterone impact is undeniable. Habit number 2. eating a diet that promotes inflammation and insulin resistance. Now let's talk about what you're eating, because diet has a massive impact on testosterone that most men completely underestimate. The standard modern diet, high in sugar, refined carbohydrates, processed foods, seed oils, and trans fats, creates chronic inflammation and insulin resistance. And both of these conditions are absolutely toxic to testosterone production. Here's what happens when you eat a diet high in sugar and refined carbs. Your blood sugar spikes repeatedly throughout the day. This leads to insulin resistance, where your cells stop responding properly to insulin. And insulin resistance directly lowers testosterone while increasing estrogen. Chronic inflammation from processed foods, excess omega-6 fatty acids, and lack of nutrients also suppresses testosterone production and increases aromatase activity, converting testosterone to estrogen. And if you're carrying excess body fat, especially belly fat, this creates even more aromatase, further lowering testosterone and raising estrogen. It's a vicious cycle. Biologically, poor diet creates a hormonal environment hostile to testosterone production. Emotionally, it leads to energy crashes, mood swings, and brain fog. Practically, it means weight gain, metabolic dysfunction, and declining health. What to do instead? You need to eat in a way that supports testosterone production. Prioritize protein. Adequate protein, 0.88 to 1 gram per pound of body weight, is essential for testosterone production and muscle maintenance. Include healthy fats. Testosterone is made from cholesterol. You need healthy fats from sources like eggs, avocados, olive oil, nuts, fatty fish, and grass-fed meat. Minimize sugar and refined carbs. These spike insulin, promote inflammation, and drive fat gain. All testosterone killers. Eat plenty of vegetables. They provide nutrients, fiber, and compounds that support hormone health and reduce inflammation. Include specific testosterone supporting foods. Oysters high in zinc, Brazil nuts, selenium, pomegranate, garlic, and cruciferous vegetables, which help metabolize estrogen. Your diet creates your hormonal environment. Choose foods that support testosterone, not destroy it. Habit number 1, sedentary lifestyle and lack of strength training. And here's the number 1 habit that destroys testosterone: being sedentary and not engaging in regular strength training. Your body produces testosterone in response to physical demand. When you sit all day and don't challenge your muscles, your body has no reason to maintain high testosterone levels. From an evolutionary perspective, why would your body invest resources in producing a hormone for strength and reproduction if you're not using your strength? Sedentary lifestyle leads to muscle loss, which lowers testosterone, fat gain, which converts testosterone to estrogen, poor circulation, which affects testosterone delivery and function, insulin resistance, which lowers testosterone, increased inflammation, which suppresses testosterone. And it's not just about being inactive. It's specifically the lack of strength training that's most damaging. Cardiovascular exercise is important for overall health, but it does stimulate testosterone production the way resistance training does. Logically, your body maintains testosterone levels based on physical demand. Use it or lose it. Emotionally, sedentary lifestyle and muscle loss affect confidence, body image, and sense of capability. Practically, it means declining strength, increasing frailty, and loss of independence over time. What to do instead? You must engage in regular strength training. This is non-negotiable for healthy testosterone. Strength train 3 to 4 times per week. Focus on compound movements that engage multiple muscle groups. Squats, deadlifts, presses, rows, lunges. Lift heavy enough to challenge yourself. You should be working hard, not just going through the motions. Progressive overload, gradually increasing weight or reps, is key. Don't overdo cardio. While some cardiovascular exercise is beneficial, excessive cardio, especially long-duration endurance training, can actually lower testosterone. Keep cardio moderate. Move throughout the day beyond structured exercise. Avoid sitting for long periods. Take breaks, walk, stand, move regularly. Prioritize recovery. Your muscles and hormones recover during rest. Don't train so intensely that you're constantly exhausted and inflamed. Strength training is the single most powerful lifestyle intervention for supporting healthy testosterone. If you're not doing it, start now. Before we move to the action plan, let me quickly mention a few other common habits that damage testosterone. Excessive endurance exercise, marathon training, ultradist, and cycling, or other extreme endurance activities can chronically suppress testosterone. Moderation is key. Environmental toxins, Exposure to plastics, BPA, pesticides, and certain chemicals can act as endocrine disruptors. Minimize exposure where possible. Certain medications, some drugs, including opioids, certain antidepressants, and statins can lower testosterone. Don't stop medications without medical guidance, but be aware and discuss with your doctor. Overtrain. Too much exercise without adequate recovery raises cortisol and suppresses testosterone. Rest and recovery are essential. Poor gut health, chronic digestive issues, dysbiosis, and inflammation in the gut can affect hormone production and metabolism. These aren't the main offenders for most men, but they're worth being aware of as part of a comprehensive approach. All right, so you understand the habits that are destroying your testosterone. Now, let's create a practical action plan for what to do instead. Step 1. Fix your sleep first. This is the foundation. Commit to 7 to 10 hours of quality sleep in a dark, cool room with a consistent schedule. Address any sleep disorders. This alone can dramatically improve testosterone. Step 2. Implement stress management daily. Choose 1 or 2 stress reduction practices and do them consistently. Meditation, deep breathing, journaling, walking in nature, or whatever works for you. This isn't optional. Step 3. Clean up your diet. Start eliminating processed food, DS, excess sugar, and refined carbs. Increase protein, healthy fats, and vegetables. Make every meal an opportunity to support your hormones. Step 4. Start strength training. If you're not already strength training, start now. Even 2 to 3 sessions per week will make a significant difference. Focus on compound movements and progressive challenge. Step 5. Dramatically reduce or eliminate alcohol. Be honest about your alcohol consumption and its impact on your testosterone. Make the necessary changes. Step 6. Move throughout the day. Beyond structured exercise, avoid prolonged sitting. Take breaks, walk, stand, and stay active throughout your day. Step 7. Get your levels tested. Work with your doctor to get comprehensive hormone testing. Total testosterone, free testosterone, estradiol, SHBG, LH, FSH, and thyroid function. Know your baseline so you can track improvement. Step 8. Be patient and consistent. Natural testosterone optimization takes time, typically 8 to 12 weeks to see significant changes. Be consistent with these habits and give your body time to respond. Now, I want to speak directly to those of you who are feeling discouraged, overwhelmed, or worried that the damage is already done. I know it can feel daunting to look at all these habits and realize how many of them you've been doing, maybe for years or even decades. I know you might be thinking, have I already destroyed my testosterone permanently? But here's what I need you to understand. Your body is remarkably resilient and responsive at any age. I've seen men in their 50s, 60s, and even 70s significantly raise their testosterone levels naturally by eliminating these destructive habits and supporting their body properly. It's not about perfection. It's not about overhauling your entire life overnight. It's about making consistent, meaningful changes in the areas that matter most. Start with one habit, master it, then add another. Build momentum gradually and trust that your body will respond because it wants to be healthy, strong, and vital. You haven't missed your chance. It's not too late. And small, consistent changes compound into remarkable results over time. Your testosterone can improve, your energy can return, your vitality can be restored. But it requires you to stop doing the things that are destroying it and start doing the things that support it. All right, here's what I want you to take away from this conversation. First, low testosterone is not inevitable or irreversible. It's often the result of daily habits that are completely within your control to change. Second, the habits that destroy testosterone, poor sleep, chronic stress, excessive alcohol, poor diet, and sedentary lifestyle are exactly the things most men are doing every single day without realizing the hormonal consequences. Third, natural testosterone optimization is possible at any age through consistent lifestyle changes that support your body's natural hormone production. If this video opened your eyes to habits you need to change, please hit that like button, drop a comment, and tell me which habit are you going to tackle first. And subscribe, because I'm here to provide practical, empowering health guidance that actually works. Remember, your testosterone levels reflect how well you're taking care of your body. Take care of your sleep, manage your stress, fuel yourself properly, and challenge your muscles, and your testosterone will respond. Age is not the enemy. Poor habits are. Change the habits, and you change everything. Thank you for being here. I'm Dr. Narita, and I'll see you in the next video. Now, go make those changes. Your testosterone and your life are waiting. Like, comment, subscribe, and hit that bell. Your testosterone matters, and so does your vitality. Take care, gentlemen.